Here to hand over to the Ministry of Health the items and or consignment which came in last month from direct relief. So we are also very happy that the director from Ministry of Health has been sent by the permanent secretary to receive on behalf of the ministry. So we thank you very much. These are other items that we can hand over to you, sir. That for the purposes. We have been suffering because the budget of the Ministry of Health is too small that cannot think of emergency medical supplies. These emergency medical supplies should be ever there because anytime, an hour, we can get an outbreak. Our partners are direct relief and they are based in California.
My name is Dr.Joseph. I'm a director in the Ministry of Health. I have come to represent the ministry in this simple but very important occasion. It's very important for two reasons. One, this is a contribution coming from the good network that has been exhibited by a union. In this country, unions are known for different things completely.
Exactly.
But we are excited as a ministry that our union for nurses and midwives is engaging in very, very constructive work through their own networks. In this particular case, as you can see, they've worked with their friends abroad, good people that have a good heart for Ugandans, and they have been able to mobilize a lot of equipment and supplies that our health facilities need a lot, as we all know. We have so many facilities that have shortages in terms of small equipment for vital signs, which are very necessary in management of patients. And we can never fill the gap. So for us as a ministry, we appreciate this gesture by the union, in addition to their core mandate of bringing us together. They're going beyond that to engage with good friends to make sure that the nurse, the doctor, the clinic officer, the health worker in a facility has everything they need to deliver quality care. Delivery of quality care is not just about financing. It's not just about construction of buildings. Government is doing a lot of construction, as you all know, upgrading facilities. We are endeavoring to provide resources for PHC, but the motivation of a health worker to provide work comes from the environment inside. If the health worker does not have a blood pressure machine, they will not take the blood pressure of the patient. If the health worker does not have gloves, they will have challenges in managing the patient. So we have supplies that government provides, but as you know, that's not enough. So that is number one.
I'm called Birungi Annette, National Treasurer, Uganda Nurses and Midwives Union. Today we had a launch of the PPEs that we received from America, from our partners, Direct Relief. We extend our sincere thanks to them. We also want to thank government, Ministry of Health in particular, Dr. Diana, Dr.Joseph, the directors there. We've been working hard to see that this consignment really comes. You know, sometimes you find that there is a lot of taxes, storage and so on, but government has tried to help us because these things are not, they are needed in the hospitals. Though they were supposed to be intended, we had requested Direct Relief to give us assistance. During COVID, like we have always done, even during COVID, we had PPEs, we had sanitizers and masks, but this time this consignment has different things, and they are worth 1 billion and plus.
The usual protective equipment and supplies that we use in facilities on a daily basis. And I have looked through the manuscript, the expiry dates for all of them. They still have a good shelf or a shelf life. Some of them are expiring in 2028, 2027. So we are going to take them to our facilities. We will not tell them to keep for Ebola because we don't want Ebola to come back, but they can use now so that they save their resources for Ebola or any other epidemic when it comes. These things are not specifically used for only Ebola protection. They are for daily use. But we appreciate. We'll put every effort to make sure that these resources are not sold. This is not for sale. We will distribute it to our public facilities and a few faith-based facilities that will benefit so that they can make best use of this, so that the last person who is the patient appreciates the value. It's not easy to mobilize these resources. It costs money. America is very far. It's therefore also not easy to transport this here. So there has been a lot of commitment on the part of direct relief, but also on the part of the union to have this here. We are going to work with the union to itemize all this equipment, capture it in our inventories, and we shall agree on the beneficiaries of this equipment so that they help our people in Uganda. Finally, once again, I want to appreciate the work you are doing, going beyond your core mandate of unionizing, but also realizing that our workers need equipment. They need a better environment. I think that's the kind of leadership that we want of all unions. So on behalf of the Permanent Secretary and the Ministry at large, please accept our appreciation. And mobilize more resources where you can.